Diverticulum or diverticula are outpouchings on the colon. They're very common as people get older. If one of these pockets gets infected or inflamed, it's diverticulitis. Just because you have the diverticula doesn't mean you have or will have diverticulitis.
Probably typical presentation is someone who's going to develop some pain in their left lower quadrant, so kind of the left lower abdomen down there. They may have some fevers or chills. They may have some change in their bowel habits. Usually the workup's going to be checking a blood test, so we're going to look to see if they have an elevated white blood count, which would suggest infection. And we'd also probably have a CAT scan of their abdomen, which would show some inflammation of the colon as well. We may see these on an urgent emergent basis in the hospital, or sometimes patients are treated and sent over to the office to evaluate these. If it's a mild case, a lot of times they can be treated with oral antibiotics. If it's severe and there's been a little perforation or a rupture there, they may have to go to the hospital and be on IV antibiotics. If this is the first 1 or 2 episodes and they respond well to the antibiotics, they may not need any surgery, but if it's a persistent problem or a complex diverticulitis, then we may be talking about doing a resection. Basically, what we look is on the CT scan, and they also have a colonoscopy ahead of time, we look to see kind of the extent of the disease. Typically, this is going to be in the sigmoid colon, which is the part of the colon that's down here on the left side. And what we do is basically go in and take out that part of the colon where the disease is located. We cut that out, and then we take the 2 ends and staple them back together to reconnect the intestines.